Good afternoon.
James.
This is a trying period for everyone.
Leaving the meeting.
There is a lot of uncertainty in a time when we need to remain calm. Therefore, it is important that we take time to take care of ourselves and our communities. We need to find healthy and safe ways to connect, unplug, and remain physically active.
Joining the meeting.
Austin Smith.
I would like to announce that N.W.T has had our first case of COVID-19. This person was not an international traveler. It was an individual who traveled to Alberta and British Columbia and returned to Yellowknife
Leaving the meeting.
in the second week of March. The person did not have any symptoms while on the flight home, but did develop mild symptoms 3 days after return. The person went for testing this week and results were called into our office late last night. I am pleased to say that the individual is now recovering nicely at home and feeling much better. In addition, the household is under self-isolation. And our best research shows that 80% of people will only ever experience symptoms of this type, which is mild. COVID-19 remains an incredible challenge for our territory, one that we will all need to work together to address. What we do know is that the situation is changing quickly in other parts of Canada. We currently have over 1,000 cases and 13 deaths. We want to learn from our southern neighbors and try to contain this virus as aggressively as possible. And to that end, I will now address the order which I have now issued. This order was effective as of noon today. Entry into the Northwest Territories will now be restricted with limited exceptions. We will also require by law 14 days of self-isolation for anyone returning to the Northwest Territories from anywhere outside our boundaries. This will be retroactive, so those who have left the territory within the last 14 days must self-isolate in place until those 14 days are up to avoid additional movement. For those who have not yet returned, they will be required to self-isolate in Yellowknife, Fort Smith, Hay River, and Inuvik. In order to protect our small, remote communities and avoid overwhelming their local healthcare systems. Those who do not have accommodations in those 4 communities will have their case assessed, and we will make sure there's an appropriate place to self-isolate. Those who have already returned to their communities can self-isolate in their homes. And all those who are now returning to the territory or in the future or have returned within the last 14 days will now need to submit a self-isolation plan to our public health department as soon as possible. We have stood up a toll-free phone service and an email address to answer any questions related to these requirements. The email is protectnwt@gov.nt.ca. The phone number is 1-833-378-8297. For other general inquiries not related to the self-isolation plan, please continue to use covid@gov.nt.ca. In terms of the self-isolation plan, there'll be people to address your concerns from 8 a.m. to 8 p.m. every day, and they can respond to voicemails or emails as quickly as possible. I will now get into some exceptions. We know our most essential services must continue, especially healthcare. To this end, essential service workers, including healthcare worker, employees, air traffic controllers, and others, are exempted under this order.
Leaving the meeting.
So are those who are coming to the territory to support these essential service workers with issues like childcare. These individuals and the employers will need to complete a thorough risk assessment, which is provided by WSCC. When they are not performing their essential service, they will be required to self-isolate. We are also exempting transient southern workers in the mining and oil and gas industries. We have been working closely with the medical teams at these sites to ensure there are screening processes in place and testing, whether done here or elsewhere in Canada. And all will be expected to self-isolate if they develop symptoms and to call a healthcare provider. No one should be attending work ill. The other key exemptions are import-export workers, like those working in logistics and supporting important supply chains, and flight crews. These workers are essential to the continuum of our economy, and they support our critical infrastructure. These workers are expected to follow strict social distancing guidelines for their entire time in the territory. Social distancing is up to 2 meters between people.
Leaving the meeting.
And if they are staying overnight, they are expected to self-isolate immediately after their shifts. Unlike anyone, if they feel sick, they need to stay in place and call a healthcare provider. Other exemptions are in place for harvesters who may straddle boundaries when participating in traditional practices such as hunting, but they do not visit other communities, and those coming up to work on N.W.T capital projects. Where these measures are necessary, if we hope to avoid what we've seen in other places and flatten the curve as we combat COVID-19, we are counting on your support to adhere to these recommendations. We are all in this together for the good of our communities, our elders, and our most vulnerable. We need to listen, stay safe, be kind, and work together. Thank you.
Thank you, Dr. Kandola. I know there are some reporters who are on the line who are unable to hear everything Premier Cochrane and Minister Tom said. We will post those remarks online so you have access to them. They're both doing their due diligence and staying home, so we appreciate them being able to call in this afternoon. So with us in the room, you can't probably see them because we're trying to do our best to social distance here. We have Dr. Kandola, Chief Public Health Officer. We have Ivan Russell, Director of Public Safety for MACA. And then over here I have Dr. Sarah Cook, who is our Territorial Medical Director. So we're going to let CPC ask the first question, and then I'll try my best to get to all of the media that's on the call. If you have your media and you have questions, please do not hesitate to ask it on the live stream. I'm following that as well. We'll do our best to try and answer as many questions as we can today. We know this is an important issue and everyone is looking to get the answers that they need. So with that, I'll ask CBC if you've got some questions.
Yeah, thanks for holding this today. It was unclear, Cochrane cut out when she said what time you guys found out, so I just wanted to clarify that before I ask my next question. When did you find out about this first case of COVID?
We found out about this case late last night. The PSA, had already gone out on this order, so it was after that.
Okay, I'm trying to find out right now if your order last night to close the borders was a proactive one or a retroactive one once we had found out about the first case of COVID in the territory.
The order to close the borders was proactive. When we found out about the positive COVID case, that was a call by the virologist. When that call was made, the order had already gone out.
The call went out around 9:50 last night. Did you find out after that?
Around 10 p.m.
Yeah. Okay, and you found out after 10 p.m. last night about
Yes.
the first case? Okay. I know you mentioned, we have a few listeners that are quite concerned about transient workers coming to their communities. They're concerned about people coming into their communities from Alberta, places where there are high cases of COVID right now. Do those workers not still pose a risk even if you are taking those measures? And what do you say to people who are worried about those transient workers coming into their communities?
So we have to review. The order is for self-isolation for everyone coming outside of N.W.T, and there's exemption for specific workers. So if those transient workers are not providing essential services, they're required to self-isolate like everyone else. We have the exemptions for the transient workers, and everyone else self-isolates. For the ones who do provide these essential services, WCC has a risk assessment for the employers that is now online, so you can look at that risk assessment, and basically you look at that worker who provides essential services and you look at the work they have to do, and they're required to do a risk assessment and reorient that work, so even if they have to provide that essential service, that they're limited as much as possible risk to other people.
Okay, great. And I am curious about enforcement, how this is going to work at the territorial border and how we're going to limit the spread between communities now that it is in the territory. People are saying from our correspondent down Hay River that people are still traveling way too much even between communities. How are we going to enforce that?
The order is specifically around the boundaries of Northwest Territories. So the order is people coming in from either land, port, or air, and there will be attendants at those points of entry where they will have to do a self-isolation plan. Because it went out as an order, there are enforcement features written into that order that includes fines and imprisonment. But that would be the extreme end. Initially, we will be asking everyone to submit a self-isolation plan. Other than those who are exempt, self-isolation plan, we will be getting their names, their addresses, more information, and then we'll be able to better track and monitor what was happening. I've issued a number of public health advisories, and there was a strong recommendation that people self-isolate if they came outside of Canada, and to self-monitor if they came within Canada to Northwest Territories. Because of what we were seeing with the increased number of cases now within Canada, the change in direction is that people self-isolate no matter where they come, as long as they come outside of N.W.T. The other change is that there's more teeth put into this self-isolation order, that it is a directive, not a recommendation.
Okay, so say if someone is going to be flying into the territory tomorrow, if this is something that's going to be enforced as of noon today, so it's now enforced, correct? So what should people do? I think there's a lot of people with confusion if they do have travel plans within the next 24 hours, if they're not aware, what directive do they take?
So the communication has gone out. It should be at the point of entry, so at the airports. At the border, there's, in the Department of Infrastructure, or MACA can talk to that, how they're going to enforce it. Do you want to talk to that, Ivan?
I can speak a little bit about the plan to do that.
Can we get you that? We'll just get your official.
So I can speak to the plan a little bit. There's three key components of our plan in support of the Chief Public Health Officer order. One of them is the point of entry patrols, and certainly that's our highways and airports. The second one is the isolation arrangements for those requiring it. And the third one is the communications plan to make sure everyone coming into the N.W.T have the information they need, and that the folks who are providing these controls and putting them in place have the information required to keep themselves safe and in dealing with the public. So for the points of entry, certainly we have the key airports and the key highways coming into the territory. So we've been planning and mobilizing since last night, and we expect some of those arrangements to be in place today. So if folks see, areas being cordoned off at the airport, areas being set up to engage the public and so on, that's being put in place for. And the same thing with the highway points. People are mobilizing today to set up highway control points to provide that engagement with the public, pass on the correct information. They are also providing communications and trying to provide advisories and signage at the stepping off point from various areas to come to the N.W.T. So somebody doesn't drive all the way from high level and end up in Enterprise and be told to turn around again. So we're very much trying to do that, as well as put the information out to our key suppliers and essential services providers as they come in, so they have an awareness of what they expect when they get to the N.W.T, as well as the other groups identified in the order, so they know what they expect and what the requirements are going to be to enter and so on. So there's a big push on the communication side to support that. The isolation arrangements we started putting in place last night, and today we expect a couple of the locations to be operational, and we're working with the other ones to put the arrangements in place as quickly as possible. I think that's the big.
Wonderful. And the person returned when? Did the person return to the territories?
When did the person return to the territories? In the second week of March.
Okay, so we're going to open the mic here to some reporters that we know are on the line. You may all have seen, I just turned up the volume, so we'll start to hear lots of those exiting the calls if people start hanging up. So I'd appreciate if you guys would please, if you're on the call now, please do not hang up the call until we're finished with these questions. It helps people watching online, residents who are concerned and want to hear these answers, so we would appreciate that. And with that, I'm going to give Ollie Williams, I know with Cabin Radio, he's on the phone. Ollie, if you'd like to ask a question to one of the three individuals we have here in the room.
Yeah, thank you, Crystal. Hello, Dr. Kandola. Is the risk of acquiring COVID-19 in the N.W.T still considered low?
We elevated the risk of acquiring COVID-19 not only to N.W.T but for Canada as a whole to high last week.
Okay, not on your website you didn't, but that's good to know. Okay, next question would be, so how many contacts have been notified so far with this case?
How many contacts have been notified by this case? We have we received the call at late last night around 10 p.m. We have a local public health nurse who is interviewing the client. We have our staff back at the Office of the Chief Public Health Officer that are reviewing the information and prioritizing the contacts. So that is being worked on as we speak. The immediate household was put into 14-day isolation. The prioritization would be for those who've had the most close and prolonged contact to make sure that they're in isolation. And in addition, we have to make sure that the healthcare providers who are assessing this individual had consistent and appropriate use of personal protective equipment.
All right, Ollie, we're going to give Mario from Radio Canada an opportunity to ask a couple questions.
Yeah, hi. I guess my first question is, what extra resources are in place to answer the calls asking for self-isolation plans? but what more resources does the government have in place to answer these calls that I'm sure are going to come in?
Sorry, it just takes a minute to rearrange here. So can you repeat that again, please?
Yeah, I guess I'm asking what extra resources are in place to answer the calls that you're going to get for people asking for self-isolation plans. People that are isolated now because of that new order.
Right. So people will have a screening tool to understand what area they fall into, and if it does require isolation lodging, then we are setting that up in the communities that I mentioned earlier. We are working with those communities to put those arrangements in place, and those communities are fully supportive and engaged in working with us to make sure that we can put it in place and sustain it for the period of time needed. If there is any additional resources required to keep that going, they will feed it back to us, and we'll find other resources to support
Leading the
them
meeting.
as necessary.
Travis.
So we have a question, I'm seeing.
Sorry to cut off there.
Sorry, Mario, I'm just going to ask a question. I'm seeing lots of people online are asking for clarification on whether or not it's mandatory self-isolation for those individuals who have entered the Northwest Territories in the last 14 days, or is this now moving forward? So if somebody can maybe address that question, I think that would be helpful.
The purpose of issuing a directive is the movement towards a mandatory self-isolation. Prior to issuing this directive, we had recommendations around self-isolation for those coming outside of Canada. In the past week, we started to see an increase in cases, a rapid increase in cases occurring in Canada, and we also noted that there was
Leading the meeting.
evidence of community transmission. We also had numerous examples of people who are not complying with the recommendation, and we are asking the community to email protect N.W.T at gov.nt.ca if they do see people violating the self-isolation order. Once we've seen this rapid increase, it was our determination that it would be a matter of time before we start to see travel-related cases coming into Northwest Territories that are just specific to Canada. We started working on the directive yesterday morning and issued the directive. After we issued the announcement, the public service announcement that we were planning to close the borders, we received our first case of COVID-19 that specifically fell in the category that we were concerned about. An individual who had not traveled outside of Canada, but had simply traveled to 2 provinces. So this was a support of the direction that we already had started to undertake.
All right, we're going to Francis from CKLB. I believe you are on the line as well. Do you have some questions? And just a reminder, we've got Dr. Kandola, Chief Public Health Officer in the room, as well as Dr. Cook, Territorial Medical Director, and Ivan Russell, who is the Director of Public Safety Division for MACA. So, Francis, did you have some questions?
Hi everyone, yes, thanks Crystal. Sorry, hard to get through all the people leaving and joining there. Dr. Kandola, in your statement you mentioned that this person traveled via plane. I'm seeing a lot of comments online asking whether the travelers that were on that flight have been notified of anything, if they were traveling with this specific individual, or are they just supposed to follow the directives to now self-isolate for 14 days now that they have returned within the past 2 weeks?
So we are undertaking the public health investigation as we speak. What we do know is that this individual was not symptomatic on that flight, but became symptomatic 3 days after. The most important individuals that we are trying to contact trace right now are individuals who would have been exposed while that person was symptomatic. In terms of that flight, the risk would be relatively low. The individual did not have any symptoms.
Okay, thank you for that. Looking at the order for people to self-isolate now, if they're coming back, to do so in the regional centers, the news release that Rationale mentioned that the government is going to have measures to help people who may not be able to find accommodations. I'm wondering if you can say what that means. Are people expected to pay out of pocket for accommodations, or will government be proactive in trying to find accommodation for travelers coming back that now have to stay in those centers?
I will be redirecting your question to the Director of Patient Safety, of Public Safety.
So while they're just moving positions there, I'll just reiterate that question was for those of you online who are asking, what does this mean for boarding and housing and things like that? So we'll have Ivan Russell here respond to that question for you.
Thank you.
Okay, the isolation lodging is for specific people who have nowhere else to self-isolate in compliance with the Chief Public Health Officer order. So they will be screened, they'll be assessed, and if they're deemed to need isolation lodging, then they'll be managed that way. And that isolation lodging will not be at a cost to anyone. Does that answer your question?
I'm sorry, Mr. Russell, I'm hearing the paper shuffling at the end of your answer there. I didn't quite catch the end of it.
Okay, so anyone who is directed to isolate and need isolation lodging as part of the assessment will be provided that lodging at no cost for the duration of those 14 days.
Okay, thank you.
All right, Paul Bickford, I think you're on the line still. Is there a question you'd like to ask?
Yes, thank you. I'd like to ask Dr. Kandola, in the press release today, it mentions that the public, because of the size of the community, were advised in Yellowknife that there was a case in Yellowknife. But, quote, in smaller communities, the public should not expect to be informed. I'm just wondering, how do you explain that? I'm sure people here in Hay River would be interested in knowing if there's a case in the community and act appropriately more than they are now. I guess, can you explain that? Especially in the case of a pandemic, shouldn't personal privacy take a little backseat to overall safety of the community?
Thank you, Paul. When we're looking at a case, and this applies to anyone, any type of public health, communicable disease, if we're looking at a case and we feel that that particular case posed no risk to the public, that we're able to isolate that person, contain that person, then releasing that name to a community doesn't serve an additional purpose, especially if a community is as small as, let's say, Wekwedi or the small communities. If we felt that there was an exposure to a community or public, then we would say that during this time.
Sorry, I think someone doesn't have their line muted, so we ask you to please mute your line.
Sorry, Dr. Kandola, there's an awful lot of noise here. I wasn't asking supervisor release says that there wouldn't be an announcement for our community that, like a river, that there would be a case here.
Yeah, we would have to look at the community and look at the population and balance privacy and risk to public. When we make those decisions in Yellowknife, it was quite clear that we could identify Yellowknife and be able to still maintain anonymity at the same time, have other communities, like smaller communities, not feel that it was their specific community. And so in that situation, when we have a large population, it is okay to release the name. With other communities that, like Fort Smith, Hay River, and Inuvik, they're large enough population, that could be assessed case by case. But in specific communities where there's a small population, we have to make that judgment.
I have a follow-up question for Mr. Russell, please. I think, Mr. Russell, you said, it sounded like, I heard you say that there would be a checkpoint or something set up at Enterprise. Did I hear you properly?
Sorry. Yes, it'll be on the highway there as it comes in. The checkpoints are being planned for locations that are sustainable. So if we have workers out there, we don't want them out, in a border location with a little support. We need to support the workers as well to allow them, as they're off, to be able to relax and self-protect as well. So we're not asking people to be out in the middle of nowhere manning a highway. We're taking everything into account when planning these locations.
And if I understand what I'm reading here, N.W.T residents will be allowed to leave and come back. Am I understanding that properly?
I'm not sure what you're referring to.
It says points of entry will be prohibited to all travelers with the exception of N.W.T residents. That's the first group mentioned. So N.W.T residents somebody from Hay River go to a high level for the day and come back in?
I'll just get Dr. Kandola to speak to that.
Yes.
Since it refers to the order.
So the order is a way of being able to contain and control the entry of individuals coming from out of N.W.T, because what we do see is that the risk is increasing. So if you're someone who, and we're going to have a lot of people coming back from March break.
Yes.
They could be coming back from other parts of Canada. They'll be coming back from international destinations. They will be required to self-isolate. But if someone has an essential medical appointment and they have to go to Edmonton, they will be allowed to leave. It is our recommendation to N.W.T residents, once they return, undergo the two weeks of self-isolation, that they should really consider delaying and postponing non-essential personal and business travel down south until the pandemic is contained and it's safe to do so. This is a recommendation, but we all know that there's very important appointments, such as medical appointments and investigations, that cannot be done here.
So we're seeing a lot. I know one of the, of course, concerns from residents, and I think this might be a question for Dr. Cook, is kind of what does this look like? What does COVID look like if it comes into my household? So is that something, Dr. Cook, that you can address for our residents watching?
Sure. So the question, I think, is about so symptoms of COVID and what it would look like. So as Dr. Kandola mentioned, for the majority of people, for 80% of people who contract COVID, the symptoms are actually relatively mild. So it may feel like a cold or a flu. So fever, cough are certainly symptoms. There can be runny nose, any of the symptoms that you'd normally get with a respiratory infection, like a cold or a flu. It is possible, though, to get more severe symptoms, and these are the ones that are really important to watch out for. So if people are experiencing shortness of breath, if people are experiencing any other symptoms that make them feel extremely unwell and concerned chest pain, severe symptoms that are causing great discomfort, it's very important to call ahead and then present to your healthcare facility. Very important, again, the messaging around calling ahead to make sure that the healthcare facility is prepared for someone to come in who may be a possible COVID case.
Perfect. Paul, Blair, do we have Blair from Northern News Services on the line?
Yeah.
Okay, Blair, did you have any questions you wanted asked?
Yes. Okay, so this
Leading the meeting.
question is for Mr. Russell.
When, proposed bid,
Can you hear me?
Yeah.
Okay. So now with export, import workers and other people working in essential services, these people, especially if they're, for example, truckers, they come and go a lot. Will they have to quarantine once they arrive here and drop off their goods? And same with transient workers who work in mining and oil and gas.
Well, I'll let Dr. Kandola speak to the actual order and what's in there, but everyone who comes into the N.W.T. will be checked. That's what I can tell you, and they'll, depending on the category they fall into, they'll provide that information for public health screening as required and given direction. So I'll turn it over to Dr. Kandola.
Hi, Blair. Those are excellent questions.
Hi.
On our website, we have a specific social distancing infographic developed for long-haul truckers. What we know is some of these truckers, they come in, they disband of their cargo, they get in, and then they go back. It is not in our interest to make our critical cargo truckers to undergo a mandatory 14-day self-isolation, particularly if they are spending minimal time and they're delivering goods. So what we have provided in that scenario, we provided very specific directions for long-haul truckers on social distancing and what that means for their specific sector, and that should be available on our website. Around the mines, those conversations are those conversations are happening separately. We know that the mines have their own screening happening at the airports, that have their own direct plane travel to the mines, and we've been working extensively with the medical directors on screening and algorithms and providing them the testing tools to be able to test and isolate symptomatic workers.
Okay, thank you. Blair, did you have any more questions you needed to ask? Maybe you have time for one more?
Yep, I have one more, yes. So now, with people who return, let's say someone returned a few days ago from outside the N.W.T, and they're supposed to quarantine now, does that mean that their whole family has to quarantine as well?
Joining the meeting.
So
Leading the meeting.
people who return outside of N.W.T and have no symptoms, they can complete up to 14 days of their self-isolation. But if they have no symptoms, the family doesn't need to complete 14 days if they have not traveled outside of N.W.T.
Okay,
So
John.
they don't have to quarantine as well then?
So let's suppose you're a parent and your student is returning from another part of Canada because their university is closed, and they're undergoing a 14-day self-isolation. What we're recommending that they do is to go onto the website and look at what self-isolation means. The family who's there don't need to self-isolate with this particular person. But if that student develops symptoms, they would then need to isolate until we figure out and test that student and make sure they don't have COVID. But while that person's self-isolation remains asymptomatic, the people who are already in N.W.T. don't need to also undergo 14 days of self-isolation. If we do that, we could have 1/3 of N.W.T. residents staying at home for no reason.
Okay, thank you.
Okay, we're gonna go to John, CTV. I think you're on the line, correct?
Leading the meeting.
Rachel Reese?
Nope. Okay, we're gonna turn it over. I know CBC's got a question here in the room.
It's for Kim.
This is Jane George. I haven't had a chance to ask a question yet.
Okay, which outlet are you calling from?
I'm from the Nunavut News,
Okay.
but I'd like to ask a question about her travel in Nunavut.
Yeah, no problem. Why don't you go ahead?
Also, yeah, there's a lot of concern already in Western Nunavut and as well in Eastern Nunavut about what's going to happen with air travel through Yellowknife, which for the people in Western Nunavut is really the only way that they can travel out of the region. I realize that there's an exemption for people with health issues, but could you please tell me whether there is going to be any other exceptions for other travelers from this region, these regions?
That's a good question. So if people are traveling from Nunavut and from Kitikmeot, where they have to go through Yellowknife to go on to their final destination, that would not be any different from other airport travel. What we would say is maintain social distancing. If they decide to spend time in N.W.T. before they went on to their direct destination, it would cause, it would be recommended not to. It would be recommended either you go straight on to your destination and avoid staying in N.W.T. for a day or two, because once you start staying in N.W.T., staying in the communities, you would have to undergo that 14-day of self-isolation as well. However, these are good questions. The intent is that people are going through airports and going on, that they maintain social distancing, they wash their hands. If they're sick, if they have a fever, shortness of breath, and cough, they shouldn't be traveling in the first place. So that risk would be pretty minimal. We also realize that your Chief Medical Health Officer has as of March 18th, is requiring that all people traveling into Nunavut undergo 14-day self-isolation. And so when we put all that together, if that's maintained enforceable, the relative risk of Nunavut patients increasing our risk for COVID is not the same as what's happening in BC and Alberta. Nunavut has no cases as we speak at this present time.
So what you were saying is if people are in transit from Nunavut, that they are exempt from putting themselves into self-isolation for 2 weeks.
Yes, and we have the exemption also for flight crews who are in transit where they have to overnight briefly, and that was put into the exemptions.
Okay, thank you. That was it for me.
Thank you. We're gonna
I
let
actually
CBC.
also have a question. Mofaim with Yellowknife, Yellowknife News.
Oh yes, absolutely. Go ahead.
Thank you. There are actually two separate questions. First question is, so Hong Kong reported 37 new cases overnight, and out of those 37 cases, 5 cases were confirmed that they were on a tour group that had visited Yellowknife. Can anyone comment on that?
No, I will give this to my comms to investigate. We haven't received any formal notification from Hong Kong.
So we'll look into that and we'll get back to you.
And we,
Okay, and, sorry.
Go ahead with your
Okay,
second question.
Second question, so I understand there is a strong military presence in Northwestern Territories, and also overnight, the Canadian military announced they will no longer be releasing information about numbers of personnel affected by COVID-19 due to security reasons. So how does this affect the numbers here in Northwestern Territories?
so in the Northwest Territories, if people are required to do MP swabs, including with the D&D here, there's only one place where they can get it. It's in the Health and Social Services system. And any swabs, doesn't matter who they are that had to be tested on, those results comes to the Office of the Chief Public Health Officer. I can direct this question to Dr. Cook so she can explain how Health and Social Services are integrated.
So I think just to reiterate what Dr. Kandola just explained, the swabs are all being.
Okay,
Okay,
so
thank you very much.
while we have Dr. Cook sitting here, I have another question. So we'd like to get some information. People are asking, what can patients and residents do to help the situation?
Thank you very much for that question. So there are a few things that people can do. The measures that Dr. Kandola has been talking a lot about are the most important. So social distancing being the main one, really making sure that we're keeping our distance from each other, doing the regular measures to make sure you're staying healthy and clean, washing your hands, not touching your face, all the public messaging that you've had. Also, it's really important, as I mentioned before, that you call ahead to your health facility if you need to come in and feel that you need testing for COVID. We will be in Yellowknife this week announcing in-car testing. This is already available in one other community. So there'll be more information to come on that. Again, in an effort to try to reduce the exposure of people with symptoms to others. The other thing I would like to talk about is the opportunity for virtual care. So we've really worked hard in the last few weeks to ramp up the opportunities for virtual care. So meaning having care provided by your healthcare provider, not face-to-face. And the reason why we're doing this, of course, is because we want to reduce any unnecessary travel for people to see their healthcare providers. We want to reduce any unnecessary presentation to healthcare facilities. And we also want to enable our healthcare providers to work remotely. So either if they're at home on isolation themselves but are well enough to work, they can provide care virtually. We also can have our healthcare providers outside of the Northwest Territories, such as our Alberta specialists, provide care virtually. So we launched this yesterday with our healthcare providers, the opportunity to provide virtual encounters by video. We're going to encourage everyone first, where appropriate, to do phone encounters. Clearly, there are some appointments that require, or some healthcare conditions that require in-person assessment, but some can also be done by video. So the healthcare provider and the patient, when discussing an issue over the phone, will make a decision whether this is appropriate for a video assessment. What we would ask of the public is to download the apps that we're suggesting for use. WhatsApp, FaceTime, and Zoom are the ones that we are encouraging for use right now. These are unregulated technologies, meaning that everyone needs to be aware that there could be privacy. There could be privacy concerns for some. When a virtual encounter is offered, there's a specific consent that will be read out by your healthcare provider so you understand exactly what that means, and you will be able to decide if that's something that you're comfortable with. But again, this is in an effort to really reduce the number of face-to-face encounters. There's more information that you can find on that on our website, which is nthssa.ca/virtual-care. I'm just going to repeat that because there's a lot of noise on the phone. nthssa.ca/virtual-care. Okay, all the information is there available for how to access virtual care.
Okay, so I know CBC, you've got another question.
Excuse me, we have a question for Radio Tiger?
Yeah, go ahead.
Leading the meeting. Minister Diane leading the meeting.
I'm just listening.
I'm sorry we didn't hear the question.
Okay,
ahead. Okay, so as for this idea, we're being told that people not complying to the public hygiene order may face imprisonment and imprisonment. How will that be enforced?
So, what Radio Tiger has raised is that they are seeing people who are not complying with the public health recommendations around self-isolation. So, as of noon today, the recommendations have changed to an order, which is why we need specific self-isolation plans. We need people's names, addresses, and contacts. These are being vetted through our public health officials. We have an email that says protect.nwt@gov.nt.ca, and we are asking the public to submit those observations through that channel, and we will be having our environmental health officers investigate any of those concerns. We've already have been investigating last week when we were when we had provided that recommendation. One of the reasons why we had to do that directive is most people may think, oh, if I get COVID-19, it's so mild, what is the big deal? So they may have symptoms and may go out to public gatherings, or they are doing activities that could expose people, they're not socially distancing, or they're not self-isolating. That hurts everyone in N.W.T. We do know this virus is readily transmissible, and you may feel good or you may have a mild symptom, but it can be fatal to our elders, those with chronic diseases, and those with weak immune systems. So do your civic duty. If anyone sees someone who's not self-isolated, report it through the protect.nwt@gov.nt.ca. Now that we have isolation plans, we can investigate with more details than we had before when it was a recommendation.
Danielle, go ahead with your question.
Yes.
How can we be?
Sorry, we're gonna just let CBC in the room here ask the next question, so we're gonna have to, we're gonna just rotate reporters here.
So we've been told, obviously it's a scary time for a lot of people, and a lot of our listeners are scared and uncertain, and we've been telling them off of what we've heard from you that the public would be immediately informed as soon as there was a case. You said you found out last night, and we weren't informed until noon. So why did you wait almost 12 hours between knowing there was a confirmed case of COVID in the territory and letting the public and the press know?
We worked as quickly as we can. There were details on this case that would inform the public health advisory that went out in noon. And so we needed to have that information so that when we informed the public that we would be able to have the time, the date, flights, symptoms, and have that information available to put into that public health advisory. Just simply going right from a phone call to a public health advisory with no information would actually elevate panic.
And on that note of elevating panic, we've been reporting to the public all week based on your website that the risk has been low of COVID spreading in the territory. That's what it's been saying on the website. I have a screenshot as of March 19th, it said it was low risk. And you're saying now that the risk had been elevated to high. We were not informed of that, and we did not see that on the website.
So this last week, there was an incredible increase in cases among Canada. So it was late last week that risk elevation from Canada had changed, and our public website needed to be updated. It was flagged, and we apologize. We will update it right now.
When did the risk increase?
From the, this would be informed from Canada. It would be on March 18th was when we heard from the Canadian officials that given the increase that we're seeing, that we can no longer say that the risk in Canada is low, that the risk is high. And that's because what we're seeing in Alberta, BC, Quebec, we've seen an incredible increase in cases. This was happening quite fast. And we then went into actions that are much more aggressive. So this whole concept of doing the directive and having the order of self-isolation was to prevent the risks within N.W.T from becoming high, similar to what we're seeing by trying to get people who are at risk, so those outside of Canada, to self-isolate for 2 weeks. So that order went out at noon today, but that was one of the measures that we were doing to keep the risk from getting even higher. Right now we have 1 case. When we started to do the directive, we had no cases, but we had already moved into the direction of it being a high risk in Canada to protect people in N.W.T.
So how can the public trust moving forward that they will be immediately informed if there is another case? If we waited 12 hours to even know if there was a case, and how can we trust that the risk levels will be properly informed? If it goes from low to high, you can see how people might be worried, might be scared that they're not getting the correct information as soon as possible. And I know a lot of what I've heard from our listeners, from people who read us, is that they're scared they won't get information and they need the truth right now and they need facts. So I'm just really speaking for them and trying to, what do you say to those people that might be a bit unsure, maybe a bit untrusting at this point?
So when we hear about a case of COVID, our immediate focus is isolating that individual or people at risk. So that is our focus. Last night, it was about contacting the individual first. I'm sure if people would want to find out they have COVID, not through the news, but by a polite call and saying, hey, you have COVID. We need to investigate further. We'll be sending someone for an extensive public health investigation. Meanwhile, we need you to do this immediately to protect the public. So that's what we did. We're getting the details now. And through this public health investigation, we'll have more details. But to do a public health advisory without focusing on the immediate isolation and protection of that person from further exposing the public and getting details that we weren't able to get late at night, that's not unfair. That's not fair. The public wants to know about a case, but they don't want to know the details about the case, so that someone in N.W.T has not come to Yellowknife can be rest assured there's a case in Yellowknife, it doesn't impact them. Those kind of information, that level of detail, we can't provide by a call from a virologist.
Okay. But that's only based on the fact that it's in Yellowknife, right? If someone is in one of the communities, they wouldn't have been informed if the case was in one of the more remote communities.
The person who actually has the COVID would be informed right away. That's the person who has the virus, and they need to be informed and they need to be immediately isolated. That's the most important public health intervention I can do to protect the public. And we need the space to do that, and the public will be informed. But remember, every one of us is at risk, and so do you want to find out from the news first, or do you want to find out directly from the Chief Public Health Officer that you have COVID-19?